stop. Can't wait. Okay, I'm gonna just listen to your lens, okay?
Med team, room 1332, building 1, 3rd floor, pulmonary renal.
Okay, well, let's put some more oxygen on her when we put the bed up. Let's start by giving an ABG.
St. Joseph Hospital nurses save lives every day. Empowered, highly skilled, and passionate about patient care, they are shaping the future of nursing care in our nation.
One of the biggest reasons I chose to come to St. Joseph Hospital was because of the nursing. Without the nursing support post-operatively, you will not have good outcomes.
The nurses are really the ones who really run the ship. The doctor is kind of like the captain, but the outcomes are really dependent on nursing care.
They expect us to assess our patients and look for things that they're not seeing.
The physician may come in, write orders, the nurse practitioner may come in and write orders, but it's really the nurse who is carrying out those orders, ensuring that those orders are correct. So there's a lot of behind-the-scenes work that is going on.
Highly specialized nursing care is practiced in the medical intensive care unit, where open heart surgery patients are admitted directly to the unit after their surgery. These nurses think quickly, act decisively, and stay calm when lives are at stake.
We're always looking for what we can do better. Where's quality? Where does quality end?
We are part of what's called a shared governance, and we are looking at evidence-based practice for our nursing and really empowering nurses to go to the research and look to see exactly what it is that we're doing on a daily basis and why. And if we find new and inventive things, bringing that back to the hospital and being able to implement that in our care on a daily basis.
We have nationally recognized programs and specialties here at the hospital: kidney transplant, cardiothoracic services, women's services, oncology, all managed and run by nurses.
Teaching patients how to care for themselves once they leave the hospital is the primary role of specialty nurses. These highly educated and trained nurses take the time to teach patients about their health, so patients and families can play an active role in the healing process.
The scientific part of nursing is combined with the nurturing part of nursing.
You're there with your heart. You get to know people, you get to know their families.
The psychological support that they give, if your emotions aren't supported, if the hope isn't given to you, the sense of, I'm going to get better, the nurses give that.
Treating the human as a whole, a person, the life within the individual.
What can I offer that person? What more can I offer? I can be taught to do a blood pressure, give an injection, and certainly those are important skills. But again, it's looking at that person as you're administering those things and looking into their eyes and into their soul and knowing, what do you really need today?
This is someone's mom, this is someone's dad, someone's brother. I'm here to take care of patients with compassion and essentially love.
It's me. This is me. I'm the nurse that provides this care.
The nursing part of us doesn't stop. The caring, the compassion, the love doesn't stop. It just keeps going.
This is probably the best hospital in Orange County, and it's the best hospital because we've had a tradition of caring and of excellence in nursing.
I've worked at 10 institutions, 5 of them being academic institutions, and I have not yet seen a nursing staff that can compare with this nursing staff. They are truly excellent. I can't overstate the importance of supporting our nursing staff, acknowledging the fantastic work that they do, and how important they are to our patients' well-being, care, outcomes.
The reality is that the nursing staff is incredibly committed to taking care of their patients. And that's your loved ones. That's the members of your family, your friends, the members of your community.
If you want to keep this tradition going, if you want the best hospital in this community to survive and prevail in this next century, you have to support the nurses. There's no other way around it.
As a physician, there is no way that I can do my job without these nurses.